my team want to explain about our system, that is ovulation test system. So this is our member, Adella Java, Aina Syazzween, Aina Khairina, and Prameswari. So this is the topic that we will be discussing. Okay, next, get to know about ovulation. So ovulation is a part of your menstrual cycle. It occurs when an egg is released from the ovaries. When an egg is released, it may or may not be fertilized by sperm. Upon fertilization, the egg moves to the uterus and it transplanted, which can lead to pregnancy. If left unfertilized, the egg will collapse during menstruation and the endometrium will peel off. Understanding how and when ovulation occurs can help achieve or prevent pregnancy. It is useful for diagnosing specific medical conditions.
For the problem statement, ovulation difficulties can now be caused by ovarian malfunction or dysfunction of the brain and glands that control ovulation. The hypothalamus, pituitary gland, ovaries, and other organs, such as the adrenal glands and thyroid gland, all play a role in reproduction. When one portion of this system fails, the problems with ovulation occur. The major goal of the system is to assist women in recognizing ovulation sign or vice versa. They will be able to identify ovulation possibilities using the ovulation test equipment at that time.
Okay, now we will discuss data collection and facts that we get in Google search engine. Once released from the ovary, eggs have a lifespan of 12 to 24 hours. After fertilization, it can take up to 12 days for an egg to become implanted on the uterus and pregnancy to be confirmed. The release of an egg is triggered by an increase in luteinizing hormone, also known as LH. The test can tell you whether or not this increase occurred. A urine test can also be used to detect LH. Fraternal twins, triplets, or higher multiples can be conceived if the ovaries release 2 or more eggs. Okay, these are common symptoms of ovulations: cervical mucus changes, heightened senses, breast soreness or tenderness, mild pelvic or lower abdominal pain, light spotting or discharge, libido changes, nausea and headache, changes in your basal body temperature. We use, as I said just now, we use search engine to collect the data and get the facts about our study of ovulation. The menstrual cycle may be used to calculate the fertile period. However, determining the fertile phase for young women whose menstrual cycles are still erratic would be challenging. To determine the fertile period, the researchers used the most likely reference estimates.
So this is our tree graph. So the first question is, period cycle more than 28 days? If yes, then you cannot do the ovulation test right now. If no, we go to the next question, which is having abdominal pain. If no, then not ovulating, so go see doctor. If yes, then go to next question, having nausea. If yes, then we go to the next question, which is having vaginal discharge increasingly. If yes, go to the next question. Is the test strip positive? If yes, then go to you are ovulating, so be prepared.
For the rules, we have 5 rules. First, the period cycle less than 28 days, then the person can do the ovulation test. For the rule 2, if the person has abdominal pain, then the person might have a stomatitis or ovulation might be coming. For the rule 3, if the person has nausea, then the person's ovulation might be coming. And rule 4, if the person has vaginal discharge, then this person's ovulation might be coming. Rule The last rule is if the test strip shows positive, then the person on ovulation day.
So this is the coding. Okay, and conclusions. For some women, ovulation doesn't always take place or it can be irregular. Certain disease or disorders and medications can cause a woman to stop ovulating for extended periods of time. Hence, we developed this ovulation test system to help women, especially ones who have problems with their menstrual cycle, by doing a medical checkup once they get the result from the system. Developing the system with immediate results also contributes to the woman making preparations as soon as possible when they tend to get busy with their life. Okay, next we want to demonstrate our system. Okay, Aina Karina, can you share screen?
And for our system, here we display welcome to ovulation test. So please enter your personal information. So the patient need to enter their personal information. So here I will enter more than 28 days. So it will say that I cannot do the ovulation test right now. So I will enter another input. So if I enter less than 28 days. So first it will ask the patient, are you having abdominal pain? If I enter yes, then it will display your ovulation might come in, please be prepared. And next question, are you having nausea recently? If I enter yes, it will display another question, are you having vaginal discharge increasingly? If I enter yes, then it will go to the next question, did ovulation test strip show positive? If I enter yes, then the result is you are on ovulation day, so please be prepared, go see a doctor for medical checkup. So another one is if I enter yes for the first question, yes also for the second, but I enter no for the third question, it will display please be alert, you are not ovulating, so go seek to doctor for medical checkup. That's all from our demonstration. Thank you.